extremely hot. He preferred fan even in the winters. So he went to the prenatal history. This being the first child, the mother informed that the first pregnancy was terminated in the 7th month due to gross cardiac anomaly in the child. In the second year of marriage, she had a miscarriage and needed DNC. And this child was the third conception. The mother vomited throughout the 9 months of pregnancy. She was also stressed all through due to her brother's conflict with her parents. And due to spontaneous rupture of membranes, she underwent emergency LSCS, and there was also breech presentation at that time. Perinatal history, the birth weight was about 3.5 kgs, and there was no neonatal jaundice. So after the entire history, what we could make out, also from questioning the parents and observing the child was extremely obstinate. He was extremely scared of lizards, which we have a lot in the South Campus, Delhi University, because there's a lot of green area around. And the child finds it difficult to sit still, especially when unwell, informs mother that he feels worse if he's asked to sit still. So what we found was a deeply syphilitic presentation and an extremely hot patient, a child who preferred cold air all the time. So going back to the materia medica, we found under this remedy that in the second stage, mucous membranes and skin ulcerations are a strong feature. Now, again, going back to Boger's synoptic, one of the materia medica I really love to follow with all its pathological generals. Incipient organic changes, syphilitic, etc., many and diverse symptoms, cachexy, stubborn chronicity, which is a nature of this disease altogether, craves motion in the open air. So we gave him a dose of Cali iode 30, 3 doses of Cali iode 30 on 12th of October 2015, and followed it up with placebo. And then we've had about 3 or 4 follow-ups with the remedy without any repetition. And they recently visited our health center, and that's what we found. The pictures on the left are the current situation, and the right is the one which he came with for the first time. As per the parents' assessment, there's nearly a 40% change in his lesions. And the blister formation has gone down. The oral lesions have improved considerably. And even the child is able to run around more comfortably now. So another case that we saw, a 10-year-old girl. This is a case at my other dispensary, which I visit, that is at Ali Village. It's a small rural setup in the outskirts of Delhi. We have nearly 152 patients, 200 patients coming there daily. Most of them from the illiterate, uneducated background. So this little girl was seen first in the year, in October 2011, 10 years old girl diagnosed with EB on the basis of histopathology by Safdarjung Hospital. She was diagnosed with it at the age of 9 to 10 months, and when we saw her was nearly about 9 years later. So again, what we saw, dark eyes and hair, thin build, average height, there was bluish discoloration around the mouth, and when we saw her tongue, it was difficult to protrude. So going back into the history, that girl developed lesions first on the left side of the body during the early months of life. The condition had worsened between the second and third year of life. Every friction, trauma, heat would lead to blister and bullous formation. Younger sister and brother also had few bullous eruptions, but they disappeared in a few months of birth. At the time of consultation, the lesions were present on the cervical region, upper dorsal region, and the left hand. Mother informed of the intrauterine history. Whatever little we could get was that she conceived her within 2 months of marriage. There was no major complaint during pregnancy. And her sister-in-law was also carrying at the same time, but she was near the term. So though she was well taken care of, at times she felt that, her sister-in-law is taken care of more than her. The girl herself was the eldest of 3 siblings, had a younger sister and a younger brother, and she would often complain to her mother that, you prefer the siblings over me all the time. So, and of course, there was intolerance of tight clothes. So with everything, lachesis was pretty easy. So in October 2011, we gave her 3 doses of lachesis 200. And somehow we've lost the first pictures, but immediately after we gave her 3 doses, which I think was 3 times too much. We should have probably given her only 1 dose. because she had a terrible aggravation of skin. Uh, all the lesions increased terribly. She was barely able to use her hands. And then gradually, a couple of weeks later, we found a gradual amelioration of the skin lesions. Then what was interesting was, in this entire case, that the lesions improved in accordance with the Hering's law. So the upper lesions improved first, and thereafter lower lesions also improved gradually. These are all the successive pictures. She did not need any other repetition of the remedy so far. And we followed her nearly for 2.5 years without any recurrence of lesions. And because I still visit the dispensary and the other family members' company, she's never had a relapse ever since. So the upper lesions improved first, and then thereafter she never had any relapse. She did not need any repetition of the remedy. Okay. So this last case that I'm going to share with you is a relatively easier case, a case of Epidermolysis Bullosa simplex in a little 6-month-old girl. She's the first case of EB that I ever saw and consulted sometime in the June 2007. The little girl was wheatish complexion, dark eyes, brown hair, had depressed nasal bridge, and was extremely cranky. There were bullous lesions at the time of consultation in the left upper and lower limbs soon after birth, susceptibility to cold and cough since birth with a tendency for delayed recovery. No details of vaccination were available, barring BCG, a scar which we could see. Nothing much we could find in the family history or the developmental history. The only general we could find, he preferred sleeping on the back or sides, never on the tummy. The prenatal history informed that the mother had 2 spontaneous abortions, first in the 2nd month and thereafter in the 4th month. And the 3rd was a stillbirth prior to this girl, so this was the 4th conception. The only concern which the mother had during pregnancy was the intrauterine, during the life, was the anxiety about the completion of pregnancy, whether she'll be able to carry the baby and give birth to a live child or not. There was mild nausea and vomiting. So this is a typical pattern of syphilitic miasm, when you have successive abortions and the development of a stillbirth, and finally you give birth to a live child. And the depressed nasal bridge in the child further confirmed the presence of the syphilitic miasm. So on June 2007, she was given a single dose of syphilinum 30. The skin gradually cleared up, tendency for delayed recovery and susceptibility cold completely diminished. She's followed up for about 15 months with complete disappearance and no recurrence of lesions. No remedy repetition was required ever. So these are some of the images that we have of the little baby. And even all the scarring that was there also disappeared. But that's all that I have to say. I believe in homeopathy, and I'm sure you do, but we need to base all our remedies and all our prescriptions on the facts. And just like these babies, faith and belief had nothing to do with them. They could not have an opportunity to have faith or belief in the system of in the remedy, but it is only the homeopathicity that matters. Thank you so much for a patient hearing. Thank you.
Thank you, Dr. Wadhwani, for a very good case presentation.
Thank you.
Yes. He is the founder of Grace Healing Homeopathy. He is a guide for advanced certificate course in homeopathy. He has presented many papers all over India and abroad, and many articles published to NJH. So, over to Chimtanwala.
Good evening. Good evening. I am the last speaker. Are you happy I am the last speaker? Did you enjoy the case of HIV? Such a difficult disease, HIV, cured with simple rubrics like fear, anticipation and fastidiousness. Simple homeopathy. Don't try to complicate that. Dr. Gyan presented the aristocratic cases of Bullosa cases, beautiful cases, few symptoms, remedy given, cured. Not one case, but 1, 2, 3, 4, 5 cases. Again, don't complicate a simple case in homeopathy. See, a person who does not believe in God cannot become a homeopath. Who all believe this? मतलब एक इंसान जो भगवान को नहीं मानता वो होमियो डॉक्टर नहीं बन सकता है. कौन बिलीव नहीं करता है? कैन रेज द हैंड. Those who believe, raise their hand. Thank you. Why did I say this? Has any of us stalwarts have told that please believe in God to become a homeopath? Yes. Dr. Kent has written in his lesser writings, a person who does not believe in God cannot become a homeopath. Has Dr. Hahnemann wrote somewhere? In aphorism number 9, how does it start? The spiritual vital force, the dynamis that animates the material organism, rules in unbounded sway in admirable, harmonious, vital operations as regard to both sensation and function, so that our indwelling reason-gifted mind can freely employ this living for the higher purpose of existence. So my friend, for me, I am blessed as a homeopath, the 4th generation in my family. 96 years in the field of homeopathy, right from my great-great-grandfather to grandfather to me to my uncle, auntie, sister, brother, everybody is a homeopath. Today's topic which I have to present is brain tumors. I have beautiful slides from Materia Medica, from Repertory, from Organon. You want to see those slides or you want to see beautiful cases cured? So I am a homeopath, a good practitioner with less teaching abilities. There are practitioners with good lecture orientation but few results. What would you like to become? Good results oriented practice. That is very important. Did Hahnemann ever say, मेरी होम्योपैथी है, बोनिंगोसेन, तुम्हारा रेपिटरी गलत है, ये मैंने सिखाया नहीं, ये गलत है, वो गलत है, मेरे को फॉलो करो? Has Hahnemann ever told in his books? No. Are we criticizing Kent? Why did he discover 200 potency, 1M potency, 10M potency, CM potency? Hahnemann has never told. But आज का सिनेरियो क्या है? Everybody is a stalwart. Dr. Vishwala said, everybody is a stalwart because everybody is giving results. No? Your approach, your understanding is important. Are you with me? For me, the most important, for example, if a Cilicia is told to you, the Cilicia is a conscientious and intelligent child, mentally want of stamina is there. A simple symptom, but how will you interpret that symptom, lack of stamina? Sulfur is a ragged philosopher. You need to interpret that symptom, ragged philosopher. Don't try to search PQRS and rare symptoms from rare remedies, rare repertories and then say sulfur में ऐसा है, वो rarely मिलता है और rarely क्योर भी करेगा. जो Materia Medica प्यूरा है, कभी देखा है किताब Materia Medica प्यूरा? Encyclopedia, herring guiding symptoms, at least go home and see once. what they have written, they are the real stalwarts. Try to gather information from there and apply in your practice. Are you with me? Now, what is a tumor? This is a tumor. A brain tumor is an abnormal growth of tissue in the brain. Unlike other tumors, brain tumor spreads by local extension and rarely metastasis outside the brain. A benign brain tumor is composed of non-cancerous cells and does not metastasize beyond the part of the brain where it originates. A brain tumor is considered malignant if it contains cancer cells, or if it is composed of harmless cells located in area where it suppresses one or more vital functions. I remember when I was doing homeopathy, though I had a very good PCB in 12th class, I opted for homeopathy and my friends opted for MBBS, and they used to tell me, "Bhai, दुनिया कहाँ से आ जा रही है? अब देखा हम तू क्या कर रहा है? See, where is the world? You are taking homeopathy? यार मेरे को वही आता है." First time I cured a case of convulsions and I told my neurosurgeon physician कि यार convulsions ठीक कर दिया मैंने. तो बोले उसमें क्या हुआ? You give sodium valproate, वो भी ठीक हो जाए. But has that granuloma, the lacunar infarct, or the space occupation lesion in brain being cured? Then come and tell me that homeopathy cures. ये symptom हम भी cure कर लेते. So can we cure definitely a granuloma, a neurocystic sarcosis, or a hematoma in brain, or a glioma? Lot of tumors. Then I had a result in one case of granuloma. Then I again went to him. See, I have cured one case. What did he tell? एक आदि तो कोई भी cure कर लेता. You must have battery of cases to show that yes, homeopathy works. Case 1, 2, 3, 4, 5, then it is not a miracle. Then it is a science. And we keep claiming homeopathy is a science, we have to show results day in and day out. What is a brain tumor? It is divided broadly into, there are about, if you go to the books, there are about 150 types of brain tumors. Forget that. हम दो पार्ट में डिवाइड करेंगे, so glial and non-glial. Non-glial में आता gliomas, astrocytomas, ependiomas and mesogliomas. Do we have to know what is astrocytoma and ependiomas? I'll tell you an experience when I was in, anybody from Dubai conference who's there here? Who was with me in Dubai? No. We had a conference in Dubai. On the first day of conference, I was called because there was a patient in coma, a cardiologist admitted in his own hospital. And that cardiologist was the doctor to the Sheikh of Dubai, King Fahd. So I was called there, and with what you call, खबरदारी से बोला गया था कि if something goes wrong, you are not in Nagpur, you are in Dubai. Yeah, you are in Dubai. But if you want, still you can try. I said, I'll try. When I went at 10 o'clock in the hospital, as he was a cardiologist, there were a battery of doctors, neurosurgeons, neurophysicians, pathologists, urologists, everybody standing in front of me. And they started. The cardiologist told me, sir, the AV, the PQ index is very less, the cure complex is big, the calcium flow is low, and the ST inversion in V1 and V2, and flat T in V6. I said, okay. Then the lung specialist told, sir, there's a collapse in the right upper segment of lung, the left is infected, and we are suspecting if it does not improve, it will again, the whole lung will collapse. Okay, sir. The urologist told me there is a recurrent UTI infection. The organism may be Klebsiella, but we are not sure because one reading is yet to come. So you have to decide what you want to treat. Okay. And they went on. I said, okay. Are we to understand or know everything in medical science? You ask orthopedic, read an ECG. Will you read? So why you expect from homeopath to know everything? He must know everything. नहीं आता? बेवकूफ homeopath है बोलो. बेवकूफ है. These were told to my grandfather, sir. ये मीठी साबुदानी गोली है बोले, कुछ इतना बड़ा दवा नहीं, कुछ नहीं, गोली क्या करेगा? So we have to know everything. I said, sir, okay, but because I had no choice. And I took the case and the patient came out of coma in one day. I'm not going to tell the what happened. In 24 hours, the patient was out of coma. And then what happened? The patient to the king of Dubai. And that seminar was my life-changing seminar. We had everything free in Dubai. I have clinic in Dubai. I have patients from Dubai. But if I fail in one case, होम्योपैथी का प्रॉब्लम है सर, ठीक होता ही नहीं है. हम 99 केस भी ठीक करेंगे ना और एक ठीक नहीं हुआ तो प्रॉब्लम किस में है? होम्योपैथी बेकार है. And the other way around, if they fail in 99 cases and heal one case, modern science, modern, it is so modern. So are we to know everything about this? कि what is glioma? But भाई पढ़ना पड़ता है. We also study gliomas are from glial tumors, they need support and all, astrocytomas are sphere-shaped cells. Some things you must know. इसलिए मेरे slides के अंदर ज़्यादातर ये सब नहीं देखेंगे आप. They highlight part because I also fail to understand कितना कैसे पढ़ेंगे. How are we able to study these sciences? Non-glial tumors, medulloblastomas, meningiomas and schwannomas. Have you ever heard about medulloblastoma? When I started getting patients of brain tumor, then I started studying what is brain tumor because in our medicine exam, it was not so important to know brain tumors because that was not expected to come. So I didn't study also. And last types are childhood tumors. They are divided into two parts, supratentorial and infratentorial. Supratentorial are astrocytomas and ependiomas, and infratentorial are medulloblastomas, astrocytomas and ependiomas. Have you got brain tumors idea? If you don't get also, no problem. We are homeopaths. We don't need to know everything. Are you with me? And then grading of tumors, how malignant it is. Will it invade the other cells or how closely its cells resembles normal cells? Yeah, can a homeopath cure conditions like granuloma, glioma, neurocystic hematoma? If yes, then do we have enough cases to support the fact that it is to say satisfactory number of cases of such conditions to show the efficacy of homeopathy? Do we have the confidence to say yes, we can cure such cases if we have in our background good number of cured cases? So, do we have the confidence of curing? नहीं तो क्या हो जाएगा, we cure one case और वो केस हमारा बन जाता बैकबोन. जो भी कॉन्फ्रेंस मिला धन वो एक केस हुई. फिर सी वंस द ड्रग इज एक केस क्योर हो गया, उसके बाद वो ड्रग को कैसा बताना इजी ना रहे. दैट्स व्हाई आई लाइक बोथ दिस केसेस. दे वेरी सिंपल केसेस, जो दिखा वो दे दिया. chronic case of HIV cured. I would like Dr. Mahesh to please print in the journals, I think. A beautiful case cured with simple symptoms of arsenic. But if I tell you that the patient was very chaotic, can you ever think of arsenic? You know chaotic means haphazard. Can you think of arsenic? If the patient is chaotic, whatever he does is absolutely chaotic. Can you think of arsenic? No. But if you go home and open repertory in the rubric chaotic, there is arsenic. Injustice cannot support causticum. Have been told to us. He's an anarchist, a revolutionary, X, Y, Z, Z. But if you open the repertory and see, character lack of caustic. So open your eyes when you are prescribing and be very simple. Okay? Case of a brain tumor. Remember one thing, never ask direct questions. In homeopathy, you are told, no? Never ask direct questions. I'll give you an example. When we were in the final year, one senior was taking the case, the girl of first year. He knew कि भाई इसको तो सब आता होगा. He was engrossed in case taking, and when the thermals came, he asked the girl, "Are you hot?" First, the girl looked at the clothes. Is it okay? Then she replied. What was the reply? Any guesses? What was the reply? Yes. Yes. But then the doctor asked the next question. Why do you feel you're hot? So don't make such mistakes and expect it heavy, but just on lighter part, direct questions नहीं बोलना. Whatever the patient says, try to interpret and go on with the case. कोई है क्या यहाँ पे? Somebody is there? वीडियो चलेगा?
स्टार्टिंग में क्या तकलीफ हुई थी, मतलब उस टाइम तकलीफ क्या हुई थी?
स्कूल में वगैरह जाता?
No, this is one of the videos of a patient cured. The child was a case of a brain tumor. I'll give you the whole case, but I want to show the video first. Just hear the video.
सर ये तो चक्कर आना, यानी इसको साइकिल से नहीं भेजना स्कूल में, और दिन भर आंखों के सामने में अंधेरी रहती थी, कुछ भी नहीं दिखता था दिन भर. कम से कम 3 दिन तक इसका यही प्रॉब्लम रहता था. ट्यूशन को भी जाना नहीं, ये तब था मेरे ख्याल से 6वीं में. तो उसके बाद में फिर हमने बहुत सारे इलाज किए डॉक्टर गेटवे हॉस्पिटल में, न्यूरोलॉजिस्ट, उनके पास में 2-2.5 साल दवा लिए, लेकिन जो प्रॉब्लम था वो कम होने के बजाय बढ़ती गया.
वो क्या बोले फिर?
उन्होंने ट्रीटमेंट करने के बाद उनसे नहीं जमा तो उन्होंने मुंबई रेफर किया.
ठीक है.
मुंबई में डॉक्टर अनीता उडवाडिया करके लेडी है.
हाँ.
तो उन्होंने भी फिर 2 साल उन्होंने भी ट्रीटमेंट किए.
हाँ.
लेकिन कोई आराम नहीं, कमी नहीं.
झटके आते थे?
बिल्कुल ज्यादा ही आते थे.
कारण नहीं होता क्या है प्रॉब्लम, क्या नहीं?
जो है बोले क्लॉट्स,
ट्यूमर जो है,
है बोले सर में, लेकिन ये दवा से कम हो जाएगा बोले. लेकिन 2 साल इनकी गेटवेला हॉस्पिटल और 2 साल मुंबई.
हाँ.
तो जसलोक हॉस्पिटल में MRI, EEG वगैरह सब निकल गए सब. हाँ. लेकिन कोई आराम पाया नहीं.
तो क्या बोले उन्होंने?
चालू रखो बोले. फिर उन्होंने और रेफर किया, आप बोले आना जाना नहीं.
Can you hear the video? He is telling that he is taking treatment from Nagpur, Bombay, convulsions है, कोई change नहीं है.
हाँ, मुंबई वाले जो अनीता उडवाडी है, उन्होंने भी बोला कि वहीं जाके तुम ट्रीटमेंट करो और वो जो बोलते होंगे सर डॉक्टर लोग वैसे आप करो, आने की जरूरत नहीं, क्योंकि हमारे से अभी जमेगा नहीं है. 2 साल तक उनकी.
So doctors all told कि बेबी इधर आने की जरूरत नहीं है, जहाँ होम्योपैथी खाना वो खाओ, वो इलाज करना करो, इसका ट्रीटमेंट नहीं हो सकता है.
ट्रीटमेंट किए.
आप पहले भी दवाई लेने
हो, मैं जाता था सर, प्लेन से जाता था. इसको 2-3 बार लेके गया, बाद में फिर उन्होंने बोला इनको लाने की जरूरत नहीं, मैं जाता था सर.
जैसे अपन ने भी सब इलाज हो गया था समझो
जी.
ये जड़ी बूटी सब हो गया था अपने.
हाँ.
फिर इधर आए.
फिर हमारा जो कंस्ट्रक्शन का काम चालू था घर का, तो ठेकेदार जी हमारे तो उन्होंने बताया कि यहाँ पर एक बार चलो, तो बोले उन्होंने साथ में लाया मेरे को फिर यहाँ पर पहले दिन। तो रश तो इतना था कि बैठने को भी जगह नहीं थी। पहले दिन फिर वापस हो गए, यानी केस पेपर वगैरह कुछ बना नहीं था ऐसा वैसा। फिर दूसरे दिन बुलाए, नंबर लगा, फिर आए। नंबर लगने के बाद में फिर जैसी आपसे मुलाकात हो गई, फिर आपसे जिस दिन से दवा चालू की है उस दिन से उसको चक्कर ही बंद हो गए सर।
फर्स्ट डे से
He says when I started the medicine, ये पिक्चर तो बाकी है अभी। पिक्चर when I started the medicine, the same day the vertigo stopped. This is the case of. There is shortage of time, so I'll cut the video now. This is a case of this is small infarct demyelination involving both corona radiata. Jaslock Hospital diagnosed as posterior, partial, periventricular, white matter, hyperintense, represents area of gliosis. Exact etiology undetermined. Such changes can occur secondary to hypoxic ischemic insult. Okay. These are the reports of Jaslock Hospital and Nagpur. The treatment given by Wadhwani Hospital in Nagpur and in Bombay by Dr. Wadhwani. The case was a 10-year-old male child came with the following complaints: pain in the head with vertigo and falling unconscious, recurrent cold and cough, pneumonia, hospitalized 3-4 times a year, no desire to eat, irritability, restlessness, listlessness, weakness after recovering from unconsciousness, pain in the whole body, convulsions occasional, increasing frequency. All complaints increased in frequency over time, growth hampered, general overall development stunted. Actually, this is a report after the treatment. Before treatment, I have not taken the case, the video, sorry. But if you had seen that patient, you are like this. मेरे को भी टेंशन तक गिर गया, यहाँ तुम लोग को तकलीफ हो जाएंगी। हम लोग बोलते कार्बोजिस में कोलैप्स कंडीशन कितना भी हो, हाथ पर नीले पड़ गए, एक आधी केस ठीक हो गए तो अच्छी बात है, और एक आधी आप ओपीडी में गए तो आप गए। सी इट इज लाइक दिस, यू ट्रीट अ केस ऑफ ब्लड प्रेशर, बीपी आपने ठीक किए, 5 साल पेशेंट लेके आया कि उसको CRF हो गया, एलोपैथ क्या बोलेगा, होम्योपैथी खा लेना बीपी के लिए, वहीं जाओ, एंड देन आपका किडनी में तकलीफ होना शुरू हो जाएंगी। वेरी इजी टू सी ऑल दिस थिंग, इट इज डिफिकल्ट टू इंटरप्रेट दैट सिम्टम इन प्रॉपर वे। Family history, nothing particular. Thermals, bathing with cold water and hot water in winter, fanning likes but nothing in particular, stools once a day, urine 6 times, desires pani puri, bhel puri, aversion to Karela and bland food. Do we make something of this case, about this case? Koi symptom? Life space, first child in the family, premature delivery in the 8th month, had to be kept in the incubator. Mother had lot of stress during pregnancy, fulfilling the needs of the husband, who was dominating and demanded everything to be done his way. Child is reserved, does not want to mix with friends, happy when father is out of work. Father wanted his child to be good at everything and constantly told him to do this and that. आपके साथ में कभी ऐसा नहीं हुआ? पहले मेरे साथ में ऐसा होता था कि हम किसी का भी लेक्चर सुन रहे ना, तो बड़ा मजा आता था, बोले यार, और हम इंटरप्रेट भी कर पाते थे, ड्रग भी सही आता था। लेकिन अपने दवाखाने में जाकर बैठे, कल कुछ दिखता ही नहीं सामने, क्या दिखने का इसमें, क्या देखूं? सर ने तो पता ऑब्जर्वर, क्या ऑब्जर्व करूं भाई, 2 आंखें 1 कान इसको, तो और क्या ऑब्जर्व करूं? Very easy to understand and interpret when you are being taught, because I am giving gravity those symptoms, that is important. But in your clinic, Dr. Mahesh cured a case of HIV, so I cured a case of HIV, or he has cured HIV, I have cured a case of HIV. What is the difference? One is more gravitating, other is ठीक है, सर्दी खांसी वगैरह ठीक किया क्या उन्होंने? So that is important for us, the gravity. patient was enrolled for many classes without giving him free time. During exams, father put him too much pressure on this performance. Father had